There was a time around 50 years ago when worrying about
Measles.
was a part of childhood, and for many remained a lifelong fear.
You really caught the measles.
Before there was a vaccine, more than 400 people died each year from the disease, and around 1,000 people per year developed disabilities. Hundreds of thousands of people who contracted measles became bedbound for weeks. Thanks to a national vaccination program, the number of new cases in the U.S. dropped from 700,000 to around 10,000 in less than a decade. At the turn of the century, measles was declared eliminated, but last year, measles made a modest comeback, with over 600 people becoming infected. It's a relatively small number, but one that has some infectious disease specialists concerned. Why? Because measles, in scientific language, has a high reproduction number. What's a reproduction number? It's basically a measure of how many people, on average, get infected by an individual with a disease. Take Ebola and flu. A sick person will typically infect 2 other people. With measles, in a population without immunity, a single person infects as many as 18 people. That's because 90% of people who are exposed to the virus will become infected if they're not immune. The higher the reproduction number, the higher the percentage of people who need to be immunized in order to curtail an outbreak. Experts say that stopping measles requires 92 to 94% of the total population be immunized, at which point you'd have so-called herd immunity. What's herd immunity? Some people, including infants and people with cancer and other diseases, can't be safely immunized for some diseases. But if herd immunity has been achieved, meaning a high enough percentage of people around these individuals have been immunized, the risk of them becoming infected remains low. Again, with measles, you get herd immunity when 92 to 94% of people have gotten the vaccine. What percentage of Americans are immunized for measles? Last year, close to 95% of kindergartners were immunized. But as this map shows, not all parts of the U.S. are equally immunized. In the states shaded in black, 5 to 7% of kindergarten children last year enrolled with a non-medical exemption from vaccination. A measles outbreak that began at Disneyland in California has brought new attention to the growing trend of parents opting out of vaccinating their children against this highly contagious disease. That's the short answer.